In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me in the studio is Dr. Martin Strik, an expert on surgical procedures involving obesity control. Hello, welcome to the show.
Hello.
So you do operate on a lot of stomachs, I guess. So what patients are the real candidates for those kinds of surgical interventions?
The best candidates are patients who are very obese, who have a body mass index which is about 40 or even higher, and patients who suffer from diseases that come from this obesity.
So it's really massive obesity. It's not just a cosmetic problem, it's more like an illness?
Absolutely. It's an illness. We understood in the last years that it's not only a cosmetic problem, but patients really suffer from this, not only organically. Some of these patients really have a psychiatric problem from this.
Really? And those patients even die earlier, don't they?
They do. We found out that patients can even die 10 years earlier than patients with a normal body weight. So it's very important for them to lose their weight.
So are there any patients you would refuse to operate on?
There are two reasons that could make us refuse a patient. One reason is if the patient is not in a physical situation for an operation, if the risk is too high for an operation. The other reason is in the patient and in his behavior, because surgery alone is not the solution of the problem. The patient has to change lifestyle and has to change the habit, how to eat and what to eat. And if we have the impression that the patient is not ready to change his life really seriously, it doesn't make sense to do the operation.
Okay, so the patient has to work together with you, and the operation is just a starting point, and the patient has to go on with lifestyle changes.
Actually, it's the middle point, because the patient has to start before operation. The patient has to work with his mind and to be convinced that he or she really wants to change his life, and then is the right moment for the operation, and then it goes on for the rest of the life.
Mm-hmm. So what generally are the post-op measures a patient needs to take after he completed surgery? Is there any special nutrition or what has he to take care of?
You have to take care of what you eat. You have to take care of the ingredients, and the vitamins and minerals are taken into the body in the small bowel, and part of the small bowel is taken out of the intake of the food. So it's very important to be under control after this kind of surgery.
So they need to see the surgeon, or do they need to see the GP to give some supplements?
The GP. It's for the long-term treatment. You need a very good and experienced GP taking care of you, and of course you have to take care of how you move your body. Mm-hmm. You have to exercise. It's not enough just to wait that you lose the weight.
But many patients who have been obese weren't able to do some exercise or to do some sports, and they get into this mood after the surgery, don't they?
Hopefully they do, but many of the patients are not used to do exercises anymore, so they have to find a way back to exercises.
So there are plenty of operations techniques. Which technique is the most suitable? Which is the one with the less risk?
The most suitable with an appropriate risk is the gastric bypass procedure, because you get the patients to lose quite a lot of weight, and the risk is at an acceptable range.
Mm-hmm. Do you operate on kids or on very, very young adults, or what is the age your border you would say, yes, here I would do some surgery on?
Until just recently, we thought you shouldn't operate on kids because they are still able to change their behavior, and they should be educated to lose weight without an operation. But we've come to a point where there are quite a lot of young adults and kids who are so obese that they will not be able to change their lifestyle enough to lose the weight. So we have to do surgery on these young patients too.
And the surgery is life-saving, isn't it?
Absolutely. On the long run, you lose a lot of life years if you do not do the surgery in these obese patients.
Okay. Dr. Strik, thank you so much for being in the studio. Nice to have you on the show. Thank you.
Thank you.